All right. So thank you so much for agreeing to do this interview. This is something that the Center for Humanities and Ethics started kind of when the whole COVID thing started. Uh,
Mhm.
Basically, we were trying to create a platform for, yes, healthcare workers, but pretty much anybody who was doing anything to help in the pandemic, and work that they were doing, and just kind of recognizing different types of people. So like we had, people from Trader Joe's, we had people from nail salons, we had doctors and nurses at UT, and it was just a chance to kind of give them a voice and kind of talk to what they've been doing to help with the effort. And it's really great to have a graduate student to tell us kind of your perspective. And of course, in light of everything that's happening, we can chat about that as well. So that's
Mhm.
kind of the way that this is going to go. But really, right now, I just kind of want to know, like, how are you right now? How are things? New house, new city.
Yeah,
How's everything going?
yeah. First of all, I appreciate y'all having me on the series.
Hmm.
Just highlighting, you know, people who are working to increase change and like be impactful. You know what I mean? So I love what y'all are doing,
Hmm.
and I'm definitely gonna go back and look at some of the other stories. I didn't really even know about it till the other day. So
That'd be great.
shout out to y'all. But I'm good. You feel me? I just got moved into my new house, which I'm in, slowly coming together. I should be getting my permit, my physician in training permit soon.
That's exciting.
And we started in about like 3 weeks. I'm anxious, but I'm excited to like be useful again. I'm excited to like learn all the things that you know
Hmm.
I'm going to learn. So I think it's a pretty good time. Just trying to stay like encouraged and just like in the midst of all that's going on in the world. So a lot of times it's like, my life is good, but not everyone else's life is good, and that kind of dampers your own experience. So
Right.
just trying to
Supposed to
just
be a
trying to like,
celebration for you.
yeah, just trying to like, even I mean, in the midst of like, COVID-19 and like not having a graduation, not supposed to have a graduation party, that ended up getting canceled, and then just trying to like, be okay with that. And then boom, to get backdoor with all that's happening in America and racial injustice and all of that.
Right.
It's just, it's a couple, it's hard to like process it all at once. But I think what I try to do is just like keep my lens in a manner where I'm appreciative of the things that I've been given, you know what I mean, while trying to take a step back and understanding like, okay, how can I use the position that I'm in
Mm-hmm.
to, make the impact in the way that I can.
Hmm. That's a good attitude to have for sure. Do you feel like things have been, what have you been up to since your fourth year activities have been interrupted? So, it's like graduation was canceled. How have you been kind of living these past couple months?
Yeah. For me, I was just trying to like educate myself on a couple of different topics. One thing was like the house buying process, obviously, because that's a whole new language, and
Yeah.
I ain't really know what entails that. So I had to like learn up and educate myself on that process, and
Right.
then like loan repayment and like my financial uh,
Huge.
uh, plan moving forward, because I don't like we don't learn medicine money like that in medical school. You know what I'm saying? At
Not
a
at
certain
all.
point, you have to have a financial plan. So like
Hmm.
I've been reading a lot of like financial literacy, literary books. Just trying to like make sure I have a plan when I start making like resident type money to attendant type money. And then just trying to get back in shape and trying to get back in like the things I like to do that I really didn't get the time to do in medical school. So like I've actually lost like 15 or 20 pounds in
Dang.
quarantine.
Been seeing you
And
on
then
Instagram.
yeah, man, I gotta put in work. And then also, just like getting back to like binge watching shows that I put off for a while.
Hmm.
Just enjoying the time off kind of thing
That's
before it
good.
like ramps way up again. You know what I'm saying?
Yeah. Are you excited about that? So you said orientations in like 3 weeks. So
Hmm.
what does that
Hmm.
entail? Like, what do you have to kind of do to prep for that?
So I've talked to a lot of my upper level residents and other orthopedic surgery residents. Like what should I do? And everyone's just like enjoy the time. You know what I mean? Like you're gonna learn so much so fast that like it's really not the best use of your energy right now to like try to read and do that, because you're gonna be put in the line of fire. Just kind of like the way when you're coming into medical school, it's like, well, that anxiety, but before you make that jump and you realize, like, okay, well, I'm in it now, like I'm gonna adjust and make sure I do well. So I haven't really prepared for that, but like I think the two things I'm most excited about is like, one, having a purpose again, like being impactful, like being able to help people and being able to like feel like, okay, I'm doing good. And then two, making money. Like I haven't had a job in like 5 years, you know what I'm saying? So to have a continuing stream of income, like I want to make my house like a smart house kind of thing. I already know like the art that I want in certain places. I already know like all those kind of things, you know what I mean? So I'm excited to learn, like earn money.
Yeah.
You feel me?
Right. And, like, do you feel like, this feels like an obvious question. You were a student, now you're a doctor. So there's obviously been change, but, do you feel like you're going to have new influence? Like, what do you think is going to kind of be this new role that you're going to have now that you're kind of in charge of taking care of patients directly in a way that we really haven't been up until now that you've graduated?
Yeah. I think it's just a new sense of responsibility.
Mm-hmm.
You know what I mean? Understanding like everything you do now actually has a direct impact to care and to an outcome. You know what I mean? Mm-hmm. And in medical school, like it's easy to kind of like dissociate the two, because like, oh well, right now the focus is passing the shelf, or the focus is making sure I get these evals or something like that. You know what I mean? Right. Because you're not the last one responsible. But now in residency, like as I'm learning, the indications for this surgery versus that surgery, it behooves me to really understand them at a keen level, understanding how to, like titrate this medication in this scenario versus, another scenario. So I think it just adds like added level of just like purpose and like another reason of why. You know what I mean? Which I think is good. It's kind of also scary, but at the end of the day, like this is the moments that, I think call most of us to the medicine of, or the career of medicine. So I'm pretty excited about that. As far as like now I'm a doctor, I don't feel no different. You know what I mean? I think maybe once I get in the hospital, start working them hours, and then have people come up to you and be like, hey doctor, like what should I do?
Yeah.
I think that's maybe
your long white coat.
Yeah, I think that's maybe when I feel it. But right now, I mean, I did get a letter in the mail that said like my name with an MD. That felt good.
That's pretty great.
And some people were like in emails, Dr. Bank, like that's cool. But
that's pretty awesome.
Other than that, like I don't really feel too different right now.
Fair enough. Do you feel like the pandemic and COVID is going to impact your intro to training, just getting started, or do you really feel like it's going to kind of be business as usual? What do you think is going to happen with all that?
I think it depends on your specialty. Ultimately, if I was going into emergency medicine or if I was going into internal medicine, then COVID-19 would be the forefront of your education, making sure that you can come in and serve an immediate impact. Mm-hmm. You know what I mean? For me, doing orthopedic surgery, it's a little bit different in that like our primary role isn't really to address that situation. You know what I mean? However, our training will be impacted by what's going on. You know what I mean? So we have to learn how to like take care of COVID-19 patients with musculoskeletal conditions as well, and how that reality changes what was business as usual. Things are slowly starting to get back to where they were in Austin. I was talking to one of the upper level residents, and like the case volume is starting to pick up. So for them, for example, like during the heavy months of March, April, May, like they had no cases, you know what I mean? And like residency is a experience where you need to do surgeries to get better at surgeries. So that kind of affected their education a little bit, you know what I mean? Also, like now, like things are going to be different for everybody moving forward. Like now telehealth has increased in the manner in which it was before. So, even changing the indications for follow-up, like, okay, well, I'm going to suture with this technique because I know that you won't have to follow up in 2 weeks, and I'll see you in 6 weeks via telehealth kind of thing, to make sure that everything is progressing as usual. And if there's something else that's wrong, then we can schedule, or if you need to come in, then you can come in versus everyone, boom, 2-week follow-up, 6-week follow-up, 12 months, you know what I'm saying, kind of thing. So I think it just changes like kind of the structure of how everyone will do their practice. But for me, it's not like I'm gonna be. I don't think I'm gonna be thrown into the fire.
Sure.
You know, intubating left and right, because that's not what we do. So, you know what I mean?
You picked ortho. Just, you know, why ortho?
Yeah. I think I like orthopedics the most because it gives me that like immediate gratification. Yeah. To fix like musculoskeletal conditions that like affect people's quality of life.
Sure.
You know what I mean? Everything from, you know, children to athletes to, you know, your grandma or grandpa, you know, your musculoskeletal system enables you function. You know what I mean? And being a prior athlete, like that's something that I really relate to. Yeah. Being able to help somebody like function in their life the best that they can. I played football, baseball. Yeah.
All of it.
Yeah. So being a prior athlete, you know what I mean? And just like really enjoying the musculoskeletal system really drew me to it. Also, like I like the surgeries itself, you know what I mean? They're like very macro, like physics engineering concepts, you know what I mean?
Definitely.
It's really crazy because like, you know, I started doing like when I started my 4th year rotation, my ortho rotation, like that's when I learned like the physics behind like fixation. Like a screw has this diameter versus the threads that are this diameter, and like how they do it on a day-to-day basis. And now that I have my house and I've been like putting things up, like I'm using those same concepts, you know? Yeah. So the first time I saw an orthopedic case, I was like, man, this is human carpentry. Dang. You know what I mean? And just like just applying those like principles, forces, you know, torque, you know what I'm saying? Like physics kind of thing. And I'm a real person every day. It's pretty exciting.
That's really exciting. All right. I like that a lot. Well, congratulations. That's, you know, it's tough to get to that point. So the fact that you're doing what you love and getting to do it in a great city and just all of that, it's really great. You know that I've looked up to you for like pretty much my whole medical school career. So
yeah,
I'm really happy to see you getting where you want to be and being really excited about it. That's really amazing. And if it's okay with you right now, I'd kind of like to maybe pivot a little bit to the events of these past weeks and just kind of see how they've been impacting you, seeing, you know, your thoughts, how you're feeling, just from your perspective, you know, what's been going on in your head.
Yeah. So it's one of those things, you know, being, you know, a minority member of society, a Black male, where we've almost been all too much conditioned to these like events where it's like, man, like another one, you know what I mean? So it starts with, you know, Ahmaud Arbery getting murdered in broad daylight for going on a run, you know what I mean? Which is like detestful because, you know, every single Black male or every single Black person that's ever gone on a run outside automatically now thinks like, man, like that could have been me kind of thing, you know what I mean? And it's hard to like, it's a hard pill to swallow, knowing that, you know, every day there's another chance that, you know, you can be wrongly victimized or, you know, unfairly treated simply because of the color of your skin, whether you like, even though you didn't do anything to deserve any of those unfair treatments, you know what I mean? And it makes you reflect to your own like experiences and your own like what's happened to your life, you know? And it's like, man, like it's just tiring, it's numbing. You know what I mean? So like you have that, and then boom, a week later or 2 weeks later, you see a video of a man like being detained with an officer's like neck, a foot on his neck. You know what I'm saying? It's just like we just want to see the code. Like, in what instance does that make sense?
Yeah.
You know what I mean? Because it's not like it's not necessary. You feel me? And it then just numbs you. It's like getting another shot of a medicine that's like aimed to like keep you down. So you can't be as happy as you want to be as, you know, like, you know, it's my graduation. I have a lot of good things going for me. I don't even feel none of that. All I can feel is the pain and suffering. Is like, damn, like, excuse me, I'm sorry. Like, man, I'm tired again. Yeah. You know what I mean? And it just like, it brings out like thoughts in you that's like, that makes you mad. You know what I'm saying?
Yeah.
So, you know, like it's just another reminder, like, man, we have so much work to do. You feel me? Because it's not okay. Like, and, you know what I mean? Like a lot of times, a lot of people, they get to certain places in life and they feel like, oh, okay, well, I'm here. So, you know, maybe I'm immune, or maybe like that's not a reality that I can face. But then every day, especially as a Black male, you realize that, like, no, all of those situations could be me. You know what I'm saying? If I get pulled over by the officer, I'm two hands on the wheel thinking like, all right, stay cool, because they're not going to ask me, oh, wait, you're a doctor? Or wait, you're an orthopedic surgeon? Nah, it's gun first, talk later. You know what I'm saying? And it's like, at any time, at any point, you can be put in compromising positions because of someone else's implicit biases and unfair judgments. You know what I'm saying? So it really just makes you mad, like, that we're still having these conversations. I remember, you know, when we got to medical school with Philando Castile, Eric Garner, that was, you know, one set of protests. And you're asked to like study through it. You know, we had first year, second year medical students studying for STEP in the midst of all this. Like, you're asking me to try to be my best person, and I can't even, I'm numb right now. You know what I mean? And like every other Black person in this country that's being asked to like live their life in the midst of this, it's tiring. But ultimately, you know, I'm like today, all four of the officers have been charged. And, you know, I think with the pressure that people are putting on the government and the pressure people are putting on like administrations, like it's causing, you know, people to see things in a different light. And with all like that's going on, it enables these conversations to be had. Because ultimately, like, if you've never spoken to somebody that's felt that pain, if you've never talked to somebody that's had that experience, you don't even know like the vantage point they're coming from. You know what I mean? Like, to all the medical students that watch this at our school, like, man, 3 times on our campus, I've been asked to identify myself as a member of if I belong on campus. You know what I'm saying? Like, oh, where's your ID? I'm watching you now ask, you know, that white guy for his ID. You come up to me and ask me for my ID, and I have to validate my presence and existence you know what I'm saying? Once every year or something like that. You know what I mean? Yeah. And it's like, it just reminds you, like, you know what, like, now, like, we're gonna invoke change, whether or not you're comfortable with the manner of which is done. You know what I mean? Like, and this is why history is so important, right? Like, you know, Martin Luther King gets shot. It was unrest, protest, riots, whatever. And then 8 days later, the Civil Rights Act of 1960, whatever was passed. You know what I'm saying? It wasn't like, oh, Martin Luther King died and some president just felt bad. Like, oh man, you know what? Like, let's go ahead and not give these people what they're asking for. You know what I'm saying? Like, let's abolish segregation. Let's make that wrong. You feel me? So until something is done to like put pressure on the administration, put pressure on what's currently accepted, you feel me? Then in 30, 40, 50 years, it'd be like, of course it's wrong to kill a Black man for no reason. You know what I mean? Where now the conversation is like, I mean, but well, did he, you know what I mean? Did he talk back? Well, you know what I mean? Was he listening to that? That's not a excuse for, you know, like killing. You know what I'm saying? Like, I don't think when you went through police training, they said, well, guess what? If they talk back, you can execute them. You know what I mean? I don't think that's in their bylaws. You know what I'm saying? And until everyone sees the position that we've been seeing for years, then I think that's when, like, until then, pressure will continue to be applied. You know what I'm saying? So I think ultimately, I hope good comes out of these times. You know what I mean? I rest in peace to everyone who has been unfairly victimized and unfairly like had their lives taken away from like stupidity and police brutality. But hopefully something good comes out of these times where our children, my little Black boy can, you know what I mean, go out in the park and not necessarily feel like, okay, well, it's dark now, I'm not going to run right now because I don't want the worst to happen.
Right. And I feel very speechless because I don't know, my heart is hurting, and I don't think there's anything that I could add that could contribute, but it makes a really big difference that you're sharing this, and it feels very real coming from you, friend of mine, and not that it didn't before, but it just kind of speaks to how imminent this all is, and how present, and how much momentum there is, and how it needs to keep going. So
my word would be like, especially like now it's like, this is like specific like to healthcare
Right.
providers, healthcare professionals, you know what I mean?
Mm-hmm,
Like
mm-hmm,
take the time to, one, obviously educate yourself on like what's going on,
mm-hmm.
and don't look at the what, but remember the why. You know what I mean? Like the ideology behind your heart failure. You see what I'm saying? Like what disease process, what in the body caused your heart pump to not move forward. You know what I'm
Right.
saying? So that then when you look at medications, you're not treating the symptom, but you're treating the etiology. Does that make sense? To bring
Of
things
course.
back to a medical perspective.
Yeah.
You know what I mean? If we can educate, or if you like could be aware of like the why behind the what's going on, and at that point, like just being empathetic and understanding, like, okay, well, like if I, not everyone is meant to go, go to sit-ins and protests and things like that. But you just, when you see your next patient that may be a patient of color, understand that, okay, they've actually been through some experiences that I don't even know exist, kind of thing, you know what I mean? And just being aware of that with that kind of kindness when you talk to them, like those are the little things that go a long way. And if everyone can move in that sense, then I think slowly but surely things will change. And even just
Yeah.
like being in the position to hear tough conversations and get somebody else's perspective or somebody else's point of view, you know what I mean? Like talk to your friends, talk to your colleagues, your patients, etc.,
Right.
who have different perspectives than you, and just try to understand like the things they've been through in a civilized and peaceful, like have useful discourse. You know what I'm saying? Like
Right.
it's okay. Like, and that's the beauty of diversity, right? Because it's differing thoughts coming together for everyone to take something from it. You know what I mean? While I'm listening to your experiences and how you came up and how things are for you and why you may feel this way and that way, I can respectfully then say my points and be like, man, okay, like that was good conversation. I understand that. So then when I'm moving forward, I understand like, okay, obviously not all white people, blah, 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 not all black people, blah, 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 you know what I mean? And that makes us better people. And if you can't be like the person you are as a physician, you're going to be, you know what I mean? So if you are inherently have like preconditioned biases, you can't treat or help other people because it's subconscious. That's what it means, you know what I mean? So I think for us as a healthcare professional, we need to use this time to reflect, educate, and ultimately just try to like understand more perspective outside of our own visual like blinders. You know what I'm saying? Like just open up your perspective so more people to more ideas and to more concepts. I think that ultimately makes us all better people.
Absolutely. My next question was, what advice you'd have for medical students or even people, starting their residency, or just thoughts to them. You kind of have already spoken to that. It was really, that's, something that we can take away from this and have our own foot in all of this and the influence that we have even as students. I know that sometimes it can feel tough to feel useful when you're not licensed and you're not employed and you're doing this and doing that. So if you have anything else to add to that, but you've given a really great answer to that just through talking to me. So I don't know if you have anything else to add. Just
remember, it's like, people first. I mean, at the end of the day, like, we take the Hippocratic oath to be the best people that we can. You know what I'm saying? And like,
absolutely.
just try to translate that past, your profession of medicine, but like into like humans itself, kind of thing. But
absolutely. So just to kind of end this on a bright note, I just really want to know what you're hopeful for in the next few months, starting your residency in the next year, just your future from here on out. You've done the work, you've put it in, and of course there's more to come, but this is definitely a pivotal year for you. So what are you hopeful for? What are you ready to get out of life, and where do you think it's going to take you?
Yeah, I think something I'm excited about, just obviously starting residency, and then I'm looking forward to like the first time I'm able to do like 75 to 80% of a case for myself.
Yeah.
Everything from the incision to the closure, we call it skin to skin. Being able to have that like shift of responsibility from where like, I'm primarily assistant to like, all right, Abraham, you've seen 5 or 6 of these surgeries. The approach, the correct intervals, what to avoid. You've seen the plate or fixation be done. Like, here's your opportunity. You know what I mean? And just when I get that moment, it's really gonna like cultivate everything I've worked hard for. Cause it's like, man, like I'm really the surgeon. You know what I mean? And I think that's gonna be a really like meaningful moment for me.
Definitely.
I'm looking forward to, you know, unfortunately I don't think it's gonna happen this semester, but I actually looking forward to like rotating students and you know, like when the next set of sub-Is come through, because I know like I'm in a position that I not have power, but I have, you know, a voice that people kind of have to listen to. You know what I'm saying? And like, remember, orthopedics is still 97% white male. You know what I'm saying? So like, I'm gonna be an upper level for a lot of these incoming medical students who have never worked with a Black person before, have never, you know what I'm saying, like really had the opportunity to spend this much time with people that don't look like them. You know what I mean? So I'm looking forward to like just being a role model in that manner. You know what I'm saying, for like the up and coming people that are interested in orthopedics, and then it's continuing to be a mentor for anybody that wants to go into orthopedics, specifically minorities, whether it be, you know, underrepresented minorities or women in orthopedics, because again, 97% white male. So I'm looking forward to like continue to have my like hand in that process. And then lastly, like my house, like I have a lot of ideas for the house. You know what I mean? Like I've been watching like
having a house. Shoot.
Thank you. Like smart home, you know, like automations, like when I wake up, you know, like I mean, I don't have money right now, but it's gonna be nice. You know what I'm saying? Like, I'm looking forward to like seeing how it comes along.
That's awesome.
In time.
If it's gonna look anything like the rug, which is already really cool, I'm really excited to see how these renovations are gonna go. So that's really awesome. And it's gonna be all from your work, and that always makes it better when you get to save up for the cool things and make them a little cooler. So that's awesome. Hey, thank you so much for taking the time. I know that you like have probably a lot going on, probably more exciting things to do than talk to me, but I really appreciate it. And if there's any last words you want to say, but I'm kind of out of questions. You've been incredible to interview, really, you know, given me some amazing things to think about. And I think that you have an incredible perspective on life and where things are heading. And thank you so much for taking the time.
Thanks for having me. I don't really have much to say. You know, again, I'm grateful for the interview opportunity. I was gonna ask if it's possible, can you share this video with me so I can share with my friend?
Oh, absolutely. I'll send it to you as soon as it saves. I'll just text it to you.
Perfect. And I love you, everybody. You know what I mean? Like, let's love each other. You know what I'm saying? And like, let's just all be the best people to be the best doctors we can be.
Yep. I'm into that. All right. Thanks, Abe. Have a great
rest of the day.